Hi, I'm Dr. Mark Lorenzato. You've experienced a condition such as near fainting or extreme weakness. This video goes through the progression of tests and discussions we need to have to understand the roots of this problem. The vast majority of pre-syncopal episodes or near fainting episodes are easily managed.
So most presyncopal episodes, lightheadedness and weakness, are due to physiological causes coming together at one time and not to underlying pathology or illness. But over the years, I've seen a number of times where there has been underlying illness. And I've always felt it fortunate for the individual when we discovered this because we could treat the underlying problem and stop its progression. Therefore, we have to do a detailed evaluation to understand these problems. In this video, I'll provide as much information as I can to motivate why we do this and to help you understand the puzzle. On the right side of the screen, you see a form. It's a one-page questionnaire. Most of it's just yes or no. Please fill it out. It's important we have this. It sets up a rapid way of interacting that's structured that helps us get through a detailed, difficult diagnostic problem sometimes. From the first video, I hope you've got the understanding that weakness and lightheadedness is usually due to not enough oxygen to the brain, and this is often related to a state of dehydration, perhaps some brain swelling due to some alcohol ingestion the night before, or a minor virus, and some vasodilation or swelling of the vessels of the legs due to heat or being stationary or having extra histamine in your system. I did not talk much about hypoglycemia or low blood sugar, but this can be contributory and is particularly pronounced in people that tend to have sugary diets. The best way to evaluate a presyncopal or lightheadedness episode is through a detailed medical history, labs, and imaging studies and a physical exam. Usually this is cut short to try to target the most essential and progress in a more lengthy way if we discover anything. The CBC, or complete blood count, is a blood test looking to see if there's anemia, but it also gives us information about possible infection from your white cell count and the type of white cells, about allergies if there are eosinophils present, about clotting problems depending upon the platelet number, and sometimes evidence of pulmonary disease and nutritional deficiency by some of the parameters. Comprehensive metabolic panel looks at liver function, kidney function, electrolytes, and gives significant clues about nutritional status and sometimes about endocrine balance. The thyroid function is essential because thyroid set the tone for many things, and an elevated or deficient thyroid will make likely other illness processes. Urinalysis is good because it shows if there's any infection contributing to dehydration, and sometimes will give us insight into functioning of the kidneys and other issues. The EKG is an electrocardiogram, is a tracing monitoring superficial electrical fields above the heart on the skin, and this gives us great insight into the rhythm of the heart and sometimes its chamber size and sometimes pathology. Besides anemia as a result of the oxygen carrying capacity of the blood being diminished, the lungs can cause oxygen not to be moved into the lungs, into the bloodstream, if there's asthma or emphysema or some other causes. So looking at the lungs is critical. The heart, if you have a rhythm disturbance, this will cause a pump transient failure. It's not pumping enough blood, not getting your blood pressure high enough, and you'll experience this lightheadedness. Low blood sugar and other nutritional problems such as ketoacidosis found in uncontrolled diabetes are always addressed. Toxin such as carbon monoxide poisoning is very critical to look at in the winter, particularly when people are using heaters that may not combust adequately or be adequately ventilated. In individuals that have a risk of atherosclerotic disease with significant narrowing of the carotid arteries, those people with family histories of strokes and dementia perhaps, and heart attacks, and in individuals who have been smokers or are of the age of atherosclerotic disease manifest, this all needs to be considered. Rarely there are going to be vascular problems that are from birth or that are anomalies. It's usually this developmental problem of hardening of the arteries that we concern with. Heart rhythm disturbances vary from atrial fibrillation, which is an irregular beat of the atria, defining the irregular beat of the ventricle, usually at a very rapid rate, to paroxysmal supraventricular tachycardia, which is an abrupt onset, abrupt end, fast heart rate, usually around 180 beats per minute, and many other causes, many other rhythm disturbances. But those are the two most common. Common causes that make heart problems worse include stimulants such as decongestants, caffeine, nicotine, and others. And irritants such as alcohol. I've seen frequently when people just ingest too much sodium in the form of soy sauce or bacon sausage or salt added canned soups and things like this, and the day following will have stretching of their atria because of overload of their vascular tree and present with either atrial fibrillation or an episode of paroxysmal supraventricular tachycardia. So diet can be directly a cause for a presyncopal episode in this way. Heart attacks that are silent are always a concern to doctors. They present with nausea without any pain, most often, sometimes with shortness of breath. And if this happens, particularly before a presyncopal episode, by the same day or previous days or previous weeks, we absolutely need to address any nausea, shortness of breath. Also, any chest pressure or discomfort or any shortness of breath at night, particularly shortness of breath on exertion, can suggest fluid buildup in the lungs and poor cardiac output. Any wheezing or fatigue that is not diagnosed or is new needs to be addressed. So in short, any concerns for nausea, shortness of breath, and fatigues need to be addressed. The treatment of presyncopal episodes, if they are from known physiological causes, such as dehydration from a known cause, a touch of a virus, and perhaps some cerebral edema from some alcohol the night prior, then you can treat this yourself and you understand what it is. If, on the other hand, it is not this, then we have to assess the data and make a best understanding of what the cause is before we can really say how we're going to manage it. That being said, most problems have simple solutions once they're understood, and this is an opportunity to see if there's anything that needs to be understood.
In conclusion, you've experienced at least one presyncopal episode or near fainting episode. This may have been from a heart dysrhythmia, a rapid heart rate, in which case I expect you to check your pulse during your next episode. It could also have been due to low blood sugars or another cause. In this video, we've reviewed these causes systematically, and I encourage you to follow through with whichever tests I have suggested need to be done so we can be certain as to the cause of this generally benign but occasionally serious condition.